MOE has recently implemented new measures to cope with the coronavirus outbreak. Apart from cancelling all morning assemblies and mass gatherings, students are now required to participate in temperature-taking exercises every day. MOE has also rolled out a study package to teach students about the coronavirus. Called Rallying Together, the lesson material includes hard facts about the virus, as well as soft skills on how to be more sensitive to affected parties. Ms. Chong Hui Kim, the principal of Farrer Park Primary School, shares more.
What's important is we learn to adjust to the needs of the situation. So what we did was we looked at our timetable and we see how we could split the children into different groups, different clusters. We had to postpone our Primary 5 Outdoor Adventure Camp, which is actually supposed to start next Monday. Nonetheless, we have explained to our children, they are a little disappointed. But I think we need to teach our children to manage disappointment. And at the same time, we also use the opportunity to teach them, to explain to them the rationale and help them understand the need for the postponement. Now, what is the worry level? I mean, inevitably, there'll be some children who hear from their parents, about this and that. And being a child, they may be afraid because their parents are afraid. And we must make sure we take good care of ourselves. Our children must learn to take good care of themselves and also to take care of other people.
We test out what the students have learned from the learning package. What are some symptoms of the coronavirus?
Coughing, sneezing, and having high fever.
It can start from very basic, like normal fever, normal cough. Then it can head to upper, very severe diseases like you're very breathless. It mainly affects your respiratory system.
What are some preventative measures you can take against the coronavirus?
We can wash our hands regularly with soap. We can also wear a mask if we are unwell so that when we sneeze or when we cough, it doesn't spread it to others. And we must stay hygienic, put hand sanitizer frequently.
Don't go in big gatherings. Yeah, wash your hands normally. Wear a mask if you're sick. And go to a doctor if you're unwell.
Are you scared of the coronavirus? Why or why not?
In a range of 1 to 10, it's actually 4. I'm not so scared of it because if everyone plays a part, we as one nation, Singapore, we can always fight the coronavirus. I'm not really scared because the coronavirus only affects people who are in contact with another person who has the virus for a long period of time, which I don't normally do. So I don't think there's a high chance of me getting the virus.
Do your parents nag at you to do certain things more, like wash your hands or bathe?
No. Yes. My mom's overprotective. She's so serious about all the diseases like hand, foot, mouth disease. For me, it's not that much. She only asks me when I sneeze, I just wash my hands. I must sleep early sometimes so I will not get diseases or not be too tired.
No. Honestly, my parents don't nag at me. I nag at them.
My brother always tells me you do the 8 steps of washing hands. So first you palm to palm,
And then between fingers,
and then both at the back of your hand. Then after that is your thumbs.
then fingers.
You wash here so that you can do here over here. And then your fingernails.
Then wrist, then you dry. Yeah.
When rubbing my hands, I usually use 10 seconds while rinsing the soap off another 10 more seconds. So the maximum timing should be 20 seconds.